Thank you, Srinivas, for the introduction, and thank you, Dr. Reddy's lab team for inviting me to talk on this very important topic in dialysis TV. Basically, all information about kidney diseases, and this is a basic topic of CKD. Why I chose this topic because what I understand is the awareness about CKD or kidney disease is very less in the community, and the awareness about other diseases like heart diseases is much more. Whereas heart disease will present with acute chest pain and there will be lot of symptoms. CKD will not cause any symptom in the beginning, in the initial stages, and because of that, what will happen eventually is we pick up a disease in the very advanced stage where we can't do anything and just we are left with option of either dialysis or transplant. So yeah, CKD is silent killer. So what are the common silent killers? So this slide says that we have diabetes, hypertension, cancer, CKD, or all of the above. So when I ask this question to general public, what they usually say is, yeah, diabetes can be a silent killer, BP can be a silent killer, cancers, yeah, everybody is aware of that, but many of them are not aware that CKD can also be a silent killer. So we'll see few data in the subsequent slides, which will tell us why it is such an important thing. If we see kidney functions, basically we all understand they make urine. By making urine, they remove lot of waste product from the body, which is produced as a result of digestion of food production metabolism. It also controls the water balance. It also maintains the bone health. It also maintains the hemoglobin. It also maintains the blood pressure. So these all things are also part of kidney functions, which usually people ignore or not aware of. They just feel we just make urine and remove the toxins. I just want to tell you there are two basic type of kidney problems. One is acute problem and one is chronic problem. So as the name says, acute problem is something which comes within few hours or days, whereas chronic problem will be there for days to months to years. Chronic means it is obviously permanent, which cannot be cured. Acute is a temporary problem which can be cured. If we see recovery, yes, in acute problems recovery can happen. In chronic problem, we can't have recovery, but we can control it. So it can be no recovery or a partial recovery. Duration, I told you, days for AKI, whereas chronic problems months to years. Causes, painkiller and infections are the common causes for temporary problems, whereas long-term problems can be because of diabetes, hypertension are the major causes. You won't have any big future issues if you have AKI, mostly you will recover, whereas if you have CKD, it becomes a silent killer, so you don't realize what is happening and this disease will eat you from inside. So many of us do not know what are the causes of CKD. So if we see 10 patients of CKD, 9 of them actually are because of diabetes and high blood pressure. So diabetes and high blood pressure both are actually silent killers. Both we do not know in initial stages, or unless we check it ourselves, we don't know we have diabetes or hypertension. Then comes heart problems, obesity, family history, tobacco use, and age above 60 years. So age above 60 years, anyhow affects lot of disease, including CKD. You have modifiable risk factor and non-modifiable risk factors. So modifiable means you can modify your diabetes, you can modify your hypertension, history of AKI and frequent NSAID use, you can modify. What you can't modify is if you have a family history, if you are elderly fellow, or a particular race or ethnicity. So why CKD is a silent killer? So I am just showing you few data which was actually published in various journals or newspapers. So we can see in US and Australia, this is an Australian data, which is actually showing that 1 in 3 Australian is suffering from CKD. And there are so many patients who are on dialysis, and every year there are so many deaths which are happening just because of kidney diseases. So it's not just a disease like diabetes or hypertension, it carries a high mortality, and there are many people in different parts of the world which can get affected because of this. This was published in Times of India, and this also shows there are a lot of problems because of CKD in India. So this has told us that kidney patients are getting younger. I mean, more of young population is actually getting affected in India because of CKD. Diabetes and hypertension were the major causes found in the study. This was done in NIMS. So they made us aware of CKD by this article, but I don't think many of us remember this article because this just went unnoticed. Few interesting facts about these three countries. So I have just put in one slide. India, we have 1 lakh new cases every year of CKD, more than 1 lakh death per year. So if you remember or if you are following the news right now, COVID-19 has taken 4 lakhs life, and this disease CKD is killing more than 1 lakh per year. So if you see in 1 year we get 1 lakh deaths, 2 year 2 lakh deaths. So this is something which is preventable. COVID-19 we didn't have vaccine and all initially, and many of us lost our nearby people because of this pandemic. But this thing is something which can be controlled. Australia, if we see 1 in 3 Australians are at risk, and 56 Australians die every day because of CKD. 30 million Americans have CKD, and it's a ninth leading cause of death in America. So no country is spared. Everybody or every country has a problem of CKD as major leading cause of one of the major leading cause of mortality. Yeah. So the problem here is this, which is like no symptoms till 90% of kidney functions are lost. That's why we are telling it is a silent killer. So it's a ticking time bomb. If we see regional data about AP and Telangana, here in different years, different studies have been done, and data definitely shows that not only the number is increasing, the people who are getting problems because of CKD is also increasing day by day. So there comes a problem: how to screen, whom to screen. So there are few symptoms of CKD which requires evaluation. These symptoms also actually they come in little advanced stages like tiredness, nausea and vomiting. There is bubbling of urine. So when they pass urine in commode, you can see so bubble sort of things. There is loss of appetite. They don't feel hungry. They eat less and they lose weight. There will be persistent itching of skin. So they keep itching without any obvious reason. Despite of using all medicine, the itching doesn't subside. Swelling around eyes and ankles. So when they start retaining water and salt, they start getting swelling around the eyes and ankles. So slowly the swelling will increase. It will involve the legs. It will come over tummy. They may become even breathless because of water collection in the lungs. There may be sleeping difficulty. They may wake up at night to urinate. So sometimes in CKD you can have increased urine output. Some kidney diseases can have decrease in urine output. So it all depends on type of kidney disease. These all are the symptoms, and when do we need screening for CKD? So shall we screen everybody for CKD? No. Obviously, the screening tool should be such that we should be able to pick up more and more people who have the disease. So it should be cost effective. So we should screen diabetic patients, hypertension patients, patients with obesity, patients who have a family history of kidney disease, patients who already have a history of kidney stones. There is a history of cystic kidney disease. They are actively smoking and age above 60 years because the chance of developing CKD is much higher in this group. That's why we need to screen for CKD. So I just told who all should be screened, but how to screen? So see, screening for any disease should be very much cost effective, and obviously if we do only urine tests for albumin and blood tests for creatinine, this is good enough to diagnose majority or number of CKD patients. These two tests are hardly costing 500 rupees in any good lab also, and it can easily say whether you have a kidney disease or not. So for screening, for such high risk patients, we should always use these two screening tests which can tell us whether we have kidney disease or not. So this is a particular flow chain which I always discuss, that we have a risk factor where we can screen, we can pick up early CKD, and this early CKD should not go to the advanced or end stage. This is where the job of nephrologists come. So we here pick up CKD early. We want to pick up all the CKD in early stages. We don't want it to progress to advanced or end stage disease. So we have few medicines, control of blood pressure, diabetes, and many lifestyle modifications which can help us from slowing the progression, delaying the progression of this early CKD to advanced stage. That's why screening is very important. An ounce of prevention is worth a pound of cure. This was a very famous statement by Benjamin Franklin. So basically, prevention is better than cure in simple words. These are the stages in progression of CKD. So as I told, we are normal, then we have increased risk. That is factor what we have discussed, and there will be a damage slowly. This damage causes decrease in glomerular filtration rate, that is the filtration rate of the kidney, then develops a kidney failure, then develops CKD, and then so these are the probably different steps where we can stop the CKD. How do you prevent CKD? So we have understood the risk factors, we have understood the symptoms, we have understood whom to screen, how to screen. Now you have screened, you have picked up the early CKD, or you have picked up otherwise a healthy person who is at risk of CKD. How can he prevent developing a CKD? The most important thing is adequate hydration. So hydration is so important that it if it is not done properly, the kidney health goes down and definitely it progresses towards CKD. Especially in situation like summer or in condition where you are in outdoor situation with harsh summer condition, you should have good hydration. Avoid painkillers. So painkillers are good, used for variety of indications. Always use them for a limited period with help of a physician or with the advice of a physician only. Unnecessary, indiscriminate, irregular, frequent use of painkillers definitely leads to CKD. Regular exercise. So regular exercise should be 30 minutes. It can be aerobic, anaerobic, it can be walking, it can be swimming, it can be jogging, but you should be doing exercise that actually controls even your blood pressure and overall well-being. Diet very specifically, we should have low salt diet, all bakery items, chips, and all fast food contain lot of salt. Please avoid them. Take more and more of green vegetable and salads. Stop tobacco in any form, including smoking. Stop alcohol and adequate control of hypertension and diabetes. So these are the things which we can do to prevent actually the CKD. So finally, I conclude by a take-home message. CKD is a silent killer. We all should understand what are the symptoms, who are at risk, what all we can do if we are at risk to avoid it, how can we screen it, how can we pick it up early, how can we delay the progression if it is picked up early. There is very poor awareness. I keep spreading this awareness about CKD because there are no symptoms. By the time we know the symptoms, we are very late. Risk factor identification. So we have discussed the risk factors of diabetes, hypertension, obesity, smoking, drinking. These are the risk factors and family history. Early screening is very cost effective. So the cost of treatment of CKD is not only economically effective, it causes a lot of negative thoughts or depression to the patient because they're always having a fear of dialysis. They always feel they are unwell and something is affecting them. So early screening can help to pick it up in early stages where we can stop the progression and we can avoid the future end stage. Then there are various preventive strategies which we have discussed, which if we follow properly, we can avoid CKD. So let's kill the silent killer before it becomes a killer. Thank you. So I got a question, how long it takes CKD stage 3 to progress further? Which condition make it faster? Yeah, so basically it's a question which cannot be answered without knowing everything. So CKD stage 3, if we have diabetes and hypertension associated and which is not controlled, it can progress very faster within 6 months to end stage. If we use painkillers and other medicines which can actually harm kidneys, it will progress very faster. If the patient has a lot of protein leak in the urine, which is not controlled, that will progress very faster. So it depends on multiple factors for a CKD to progress faster. If we adequately control those conditions, then definitely the progression can be slowed down. Although, as I told you in previous slides, CKD cannot be cured, it can be controlled like diabetes and hypertension.
So we had one more question from Rajiv Gupta. Sir, is any demographic aspect is also associated with this disease?
Yeah, definitely. We have few belts even in Andhra where we have cystic kidney disease as very common. So you must have heard of Odanum nephropathy. So in some areas we have some typical type of CKD for which a lot of research has been going on. and we are yet to find the exact reason, and we are yet to find exact method which we can prevent or avoid this type of disease. But definitely, there is a regional or demographic aspect of to the CKD.
We had one more question from Ibrar. So, which is the best vaccines for the CKD patients? To elaborate on
Okay,
this.
yeah. So COVID vaccine, all the vaccines can be given to CKD patient. There is nothing known as best or not the best vaccine for COVID. So we have given our patients Covishield, we have given Sputnik, we have given Covaxin also. The response of all the vaccines has been good, and I would be happy to tell you that those whoever got vaccine, I mean CKD and transplant patient, they had very less severe COVID infection as compared to those who could not take. So all vaccines are safe, equally efficacious. Whatever is available, please take it.
Yes, sir. One more question also. Patients or CKD patients, those who are having the arthritis, how to manage with the painkillers?
So before that, one more question has popped up. Can the vaccine be taken on day of dialysis? No.
Yeah.
As like all vaccines, we usually give it on the next day of dialysis, because on dialysis we give heparin. So there may be a small possibility of developing a small hematoma there, but most of the times we don't have that issue. But still, to be on safer side, we vaccinate on the next day. Yeah. What
Yes,
was
sir.
the other question?
Other
Arthritis.
question.
So as I told you, painkiller should be taken with an advice of a specialist. So in arthritis, we have typical episode of flares. So whenever there is a flare, we have to take painkillers for that limited time period. Usually what happens, like if the painkillers are advised for suppose 15 days, we take the 15 days, but after 15 days, we decide on our own what to do. So when there is pain, we take; when there is no pain, we don't take. So that thing has to be monitored, and as per physician's advice only, we should take it. That is one thing. Second thing is there are different type of painkillers. One is NSAID like Combiflam, Voveron, Nice, Brufen. These all are NSAID. These are more toxic to the kidney. So suppose if you have a pre-existing kidney disease, in severe or acute pain which is not controlled with other medicine, this medicine can be given for short time. But at the same time, as soon as the pain intensity comes down, we should switch over to other painkillers like paracetamol or tramadol or their combination, so that we can avoid the exposure to toxic drugs. This is how usually we can manage the arthritis and painkillers.
So, is CKD is a hereditary disease, and
Yeah.
what are the food habits and lifestyle we can have for this to avoid CKD in
Yeah,
future?
yeah. So not all CKD is hereditary, but some CKDs can be hereditary. To be very specific, if we want to ask, some cystic kidney disease like autosomal dominant polycystic kidney disease can be hereditary. Then you have some syndromes, Alport syndrome and all, which can be hereditary. There can be some autoimmune diseases like SLE, which can be hereditary. Diabetes and diabetic nephropathy can be there in families. So diabetes can come in family, and diabetes causing kidney disease can be there in family. So it can be, but there are some diseases, some CKD, which are not at all familial or which are not hereditary. What is the food habits and lifestyle we have to follow when we are young to avoid CKD or diabetes in future? So basically, this is what I had put in one slide. So CKD and diabetes both are little similar, but the active lifestyle of we have to use adequate hydration. We should not be dehydrated. We should have some physical activity at least 30 minutes in a day, which can be aerobic or anaerobic. Restrict your salt as much as possible. For diabetes, you have to cut down on your calorie intake, especially refined sugars, which are more in bakery items and other things. We have to avoid them, which will cause actually obesity, and obesity will actually in turn cause diabetes and CKD both. So these are the few lifestyle things which we can all apply to avoid CKD and diabetes both in future.
Sir, one more question. I mean, apart from this, sir, thank you for giving
Hmm.
the answers. Sir, now third wave also we are expecting in next 1 2 months. What are your suggestions for not only our CKD patients, of the general population, general public also?
So see, these waves are part of viral infections. So earlier also we have seen there were 2 to 3 waves in Spanish flu also. So waves are not in our hands. What is in our hands is to get prepared for the wave. So how can we get prepared is obviously one thing is vaccination. Second thing is keeping your nutrition proper. We should have proper calorie, proper protein intake, proper vitamin intake. We should be doing active physical activity. We should be not obese, and we should have regular follow-up. Also, what happens is there was a lot of stigma about COVID even in first wave and second wave. So if you pick up COVID early, then obviously treatment wise we can do certain things. If we pick up in later stages and we don't do test, we not only become late in treatment, we also spread it to many people who are around us. So these are the things which I want to say for third wave. So and mask obviously, whether you are vaccinated, not vaccinated, please use mask. Mask is one thing which has probably saved a lot of people from getting affected. So these are the few things which we can do.
So one more question from audience. What are the fluid restrictions from kidney patients for kidney patients?
Yeah, so there are two types of kidney diseases. One kidney disease has actually where we excrete less amount of fluid and we develop swelling. The other type is they have concentration problem, so the urine doesn't get concentrated. They make more urine. So the first type of disease where you get swelling and you don't remove enough water from body, you have to restrict fluid. So how will you find? You will start noticing swelling in your legs. That says that you have extra fluid in your body. So this is the time when you have to actually stop taking fluid or cut down your fluid to around 1 liter per day. When we say fluid, it includes water, tea, coffee, milk, buttermilk, whatever liquid you want to take. Whereas the other type of disease is where you actually make more amount of urine because kidneys are not concentrating their urine. So in this type of kidney disease, actually you need to not cut down your intake. You have to increase your intake to match the urine output. Suppose if you are making 3 liters of urine, you have to take at least 3 liters of water also. Otherwise, you will become dehydrated. So different type of kidney disease, different type of management of fluid, but most of the CKD will have swelling. So we have to restrict for most of the CKD patient. Very few patients have this type of CKD where urine is more.
So one more question also from Ajmatullah. Sir, how can we delay acute kidney injury?
Yeah, so AKI in community commonly what we see is because of maximum because of painkiller intake. So painkiller unnecessary without any guidance we should not take because they will cause definitely kidney failure if not taken properly. The second we get is because of infection. So infection, if treated in early stages, will not affect kidneys. So early and prompt treatment of infection with antibiotics can help us to delay AKI. There are many other reasons of AKI which are not in our hands. So those I am not going to discuss. These two things what I commonly see or what we commonly see in community, we need to avoid that.
So now we don't have any questions, doctor. So thank you, doctor. Thanks for giving your valuable time and giving suggestions to the public to create the awareness. So with this, on behalf of Dr. Reddy's, I thank Dr. Santhosh and all the participants for taking time out. I wish your day is filled with positivity and good health because good health can't wait. Thank you. Jai Hind.
Thank you. Thank you so much.